Our story today, with the title Without Consent, is set in Prahran, Melbourne in 1976. It is simply a shocking tale that should never be told. It should be hidden away because our medical student, Alice, is so ashamed of being a part of it. As an author, that is precisely why it should be told and heard by others. This story shines a light on barbaric, normalised practices in medicine of old, so hopefully they will not be repeated again. Listen to the very end to hear this important tale. Let's get started. Without Consent, Prahran, April 1976. Our fourth year group is composed of 8 medical students. We're standing at the entrance to one of the surgical wards at the Alfred Hospital, Melbourne, looking awkward and waiting for our surgical consultant, Dr. Tony Bassart, to meet us for our weekly clinical teaching session. Dr. Bassart arrived at a cracking pace and strode into the ward, signalling for us to follow him. There was never a greeting ushered from Dr. Bassart's mouth, just a hand signal to move forward and follow him. We all followed him, like a mother duck being followed by her 8 ducklings, and approached the first bed in the 6-bed ward. Dr. Bassart didn't say anything to the lady lying in bed 1. He immediately drew the curtains around the lady's bed and then promptly turned his back on her and spoke to our group. Today, you're going to learn how to do a PR examination, Dr. Bassart stated. How many of you have done a rectal assessment before? No one raised their hand. The only way to learn is to do it, and you need to do it on as many patients as you can, so you can get a feel for it, he continued very seriously. We all listened intently now. We had been based at Monash University, Clayton, for the last 3 years, learning all the basic sciences of being a doctor. They were our preclinical years. Now we're in the last 3 years of our 6-year degree course. These were our clinical years, where we were based at Melbourne hospitals and clinics to learn all the essential elements of physical examination of a patient, investigation and management of their condition. We all knew that a PR, or per rectum examination, was an essential part of the general abdominal assessment. We would all be grilled on it before the end of our 4th year. We were expected to have done at least 10 or more such examinations on actual patients, to know what to feel for and what the purpose was for such a personal, intimate and embarrassing examination of the patient. We're all asking ourselves, how do we ever get practice at this sort of thing? And how would a patient ever give consent for a mere medical student to do it? I realised I had missed some of Dr. Bassart's words while I had been thinking about this. Each of you put on a disposable glove and put a little silicone jelly on your index finger, then feel inside the patient for masses. You have to be systematic, feeling the anterior wall of the rectum first, to the symphysis pubis, the pubic bone, then feel laterally, both sides, and then posteriorly. In the female, you will take note of the vagina and uterus, anteriorly and superiorly. In the male, you will feel the prostate anteriorly and note its characteristics and size. Are we clear? I noticed he didn't ask if there were any questions, just, are we clear? Of course, not one of the students dared say anything. We all felt intimidated by Dr. Bassart's manner. He was also a towering figure of a man, which didn't help. All right, just start off then, he said sternly. Only then did he turn to the patient, Mrs. Reed, and say, almost in passing, I've got a few medical students here today, and they just want to examine your back passage. So that statement was Dr. Bassart's method of obtaining consent, I thought. I could see Dr. Bassart's name on the head of Mrs. Reed's bed, so obviously she was a surgical patient who had been admitted under his unit of the hospital. The first two students proceeded through their exam. Now it was my turn. I did as I was told, and I performed a systematic PR, but I noticed how uncomfortable the patient seemed to be feeling. Surely Dr. Bassart was not expecting this lady to have a rectal examination performed on her by 8 medical students in turn. But Dr. Bassart just kept hand signalling to my fellow students to go forward and perform the exam. After 5 students had done their PR, I could see the lady lying on her side, quietly sobbing. Surely we will all stop now, I thought. Surely we are not going to continue. Dr. Bassart said nothing and signalled to the last hesitant few students to go forward and perform the examination in turn. When we had finished, Dr. Bassart approached the patient and simply said to her, "That's all over now. Wasn't too bad, was it? I'll be back to see you tomorrow. Nurse will give me a rundown on how you're going." He then pulled up the bedclothes around the patient and opened the curtains from around her bed. He signalled to our group to follow him as we left the ward. I looked back at Mrs. Reed, who was on her side in the fetal position, still sobbing quietly in her bed. What had I just been a part of? Why didn't any of the students, including myself, raise an objection? I had been one of the perpetrators. I felt deeply embarrassed and ashamed of myself. Once we got into the clinical tutorial room, Dr. Bassart went to the whiteboard and headed it PR in big letters. He gave us a 10-minute tutorial on the procedure and what we need to know for our exams, and then he was questioning us on what our findings were with Mrs. Reed. There was never a mention of the abusive act we had all just perpetrated on this dear elderly lady in hospital without her consent. That's the end of the story. Thanks for listening. For more short stories, go to my YouTube channel at Dr. Diane Leslie Webster or read my novel, which is a collection of many short stories about the life and times of Dr. Alice. It's called 4 Ways to Die at Riverside Towers, the same name as one of the stories. And it's available on paperback from Amazon or ebook from Kindle. I hope you have a peaceful day today and every day.